Hello, everybody. This is Dr. Unati, your host. I'm back. I'm so excited to be back, guys. You know, self-care is fundamental in our community. I had to take some break to take care of me. So I'm back, energized, and ready to serve you. Today, I'm coming back with a nice show for you guys. And I think if we discuss these issues in such a wonderful platform, this gives us opportunity to explore things, ask questions. In our show, there is no stupid questions. So please drop comments, drop in your questions. We're here to discuss these issues that will leave us transformed. All right. So share the button. We're a community where we are empowering each other. You know, the one thing about being African is being into doing things together. So share the button, like, invite friends, invite your in-laws. This is a topic that is very close to our hearts with Dr. Amarashi because she works in this field where she sees a whole lot of dynamic of emotions. So please bring your friends, bring your colleagues, bring your relatives. I want in-laws to come here. All right. Before we start our topic, I'm going to introduce our guest, Dr. Amarashi Ijeoma. She is in Nigeria. She is we met in the streets of this social media. She's amazing. I love what she does. She is a medical officer, basically medical doctor. She is a fertility doctor. She is a public speaker. She's an author. She does a whole lot of things. But what actually connects us is love for public health. She's amazing. She loves teaching. She loves teaching about those things that are difficult to talk about. So today, bring your friends, bring your colleagues, bring your relatives. Come, let's connect and discuss such a wonderful topic. Welcome, Dr. Marashi.
Oh, welcome. Thanks for having me on your show.
Thank you so much, sis. I'm so happy to connect. It's like it's live. I really love that. It's like we're in person here. So today, we are discussing uterine fibroids, infertility, and their effect on mental health. Guys, I want you to bring your husbands, your in-laws, everyone to come and sit here with us because infertility sometimes is misunderstood. A lot of times families believe that when a couple is unable to produce those kids, and I know that in Africa there tends to be this mentality that when people are married, automatically they must have kids. Sometimes it doesn't happen that way. And sometimes the couple does not even want to have kids. Or sometimes the problem could be with the husband or it could be the wife. This thing occurs 50-50, guys. So I would like you to bring those relatives so that they can get clear facts because we tend to have a lot around the topic. Again, welcome, Dr. Amarashi. I'm going to give you an opportunity to talk about this topic. So before people start wondering what we are about, do you want to share with us what are uterine fibroids? People are probably wondering, what is that? What is Dr. Unati talking about? Over to you, sis.
Okay. All right. So thanks for having me once again on your show. I am so happy to be here. So I have highlighted some points that I would like to share with everyone today. And I'll start by defining what uterine fibroids are. So uterine fibroids are growths on the womb that are not cancerous and usually appears during childbearing age of women. Obviously.
Yes.
So the fibroids actually the cause is unknown. And but researchers, over the years have looked at some factors that could actually cause uterine fibroids. Some research say it could be genetics, that's the genes, and then some say that the female hormones, which are the estrogen and progesterone, are implicated. And the reason they feel that these hormones are implicated is when they test the fibroid tissue, they found out that it has more estrogen and progesterone than the normal tissue of the womb.
Okay.
So, and then they also noticed that fibroids tend to shrink, that's to reduce the size after a woman reaches menopause.
Okay.
So, yeah. But these are not, like, it's still, the research is still going on, so we can't categorically say these things. These are just research findings for now. And then I would also like to talk about the people at risk for uterine fibroids. Well, once you're a woman, you're at risk. Wow. Once you've gotten to the childbearing age, and then research has shown that it is more common in the Black woman.
Yes.
This doesn't mean that all women can have fibroid. I mean, all races can have, but it's just if there's more risk in the Black woman than in other races. And then if you have somebody in your family that has fibroid, the chances that you would have fibroid is also higher than that of somebody that doesn't have any family history of fibroid. Yeah, so I would also want to talk about like the symptoms. So people want to know if I have fibroid, how will I know? Mm-hmm. Okay, so the truth is that fibroid is mostly not symptomatic. That is, when you have fibroid, you might not know for years. So most fibroids are usually noticed during maybe a routine medical examination. Maybe you went to the hospital for something else, and then your doctor was doing like a pelvic examination, and then just came across it, or maybe you're doing a pelvic scan for some reason, and then you just came across the fibroid. And most fibroids are, in fact, most fibroids are not symptomatic, and then they are mostly benign. It's on very rare occasions that you can see fibroids becoming cancerous. Extremely rare occasions. So, but however, fibroids sometimes can also be symptomatic. And then when it's symptomatic, that's when you complain of very heavy menstrual bleeding. Mm-hmm. You complain of pain during menstruation. Depending on the size and the location of the fibroid, you complain of difficulty urinating. You complain of frequent urination. You complain of constipation. Well, luckily today I'm at work, and I have this diagram that I use to explain to my patients about fibroid. So I'm going to bring it here.
I love that.
And then, okay, so yeah. Yes. So this is like the diagram of the female reproductive organ. So we have the inside of the womb. This is where the baby lies. And then you have the tubes, and you have the ovaries. But today we are more interested in the womb itself, like this muscular tissue right here. Yeah. So fibroids can be in like different locations. So fibroids can be in between this muscle here. It can be just outside of the muscle, and then it can be inside where the baby is supposed to be lying, the baby bed. So now, most times when the fibroid is outside or in the middle of the muscle, we don't really have a problem with it most times. But then when it's here, where the baby is supposed to be lying, then it can now start affecting fertility. And then it doesn't exactly prevent you from getting pregnant. It's just that when the fetus starts to grow, it starts to compete for space with the fetus. Now, this can actually affect fertility because then it can cause miscarriages, it can cause preterm labor, it can cause fetal death while the baby is in the womb. And then I just needed to use the diagram basically so that I can but just the point.
Yes.
Yes.
Before you go on, right?
Yeah.
Before you go on, I know that you were mentioning in your discussion that they can be benign. Just for our viewers here, benign means it's not going to cause cancer. A lot of these lesions, like Dr. Marashi was saying, most of them, these are muscular. They develop from the muscular part of your womb. So I just want people not to say, what is that? What is that benign? It's basically, it will not cause cancer, but of course, she's saying that in rare occasions, they might. All right, because she's mentioning that they are hormone dependent. All right, go ahead, Dr. Marashi.
All right, and then most women, I hear like when they say that they have fibroid, they're scared. You know, they think it's a death sentence, but really it isn't. You know, I mean, about 20 to 80% of women of childbearing age have fibroids. Yeah. And that simply means that if there are 10 women, 2 to 8 women have fibroids. Mm-hmm. And out of those 8 women, 4 of those women will be living a very normal life. The remaining 4 might now, like, maybe they have like symptoms of fibroid and then they bleed too much, and then, you know, when you bleed a lot, you tend to have low blood in your body, and then sometimes on rare occasions you might need transfusion, and then, you know, but the rest of the other women are living relatively normal life. So it's not all about once you have fibroid you want to take it out or something. No. Most times when we are talking about fibroid and then you come to my office, basically, most times the treatment is watchful waiting. I mean, I just want us to observe, you know, let's wait. If it's not causing any symptoms, if it's not affecting your normal life, if it's not in the baby bed and if it's not big enough to affect anything, go on with your normal life. Life goes on, you know. But in cases, yeah, in cases where you're symptomatic, we might want to give you some blood supplements. Yeah, we might want to also take it out surgically. Yeah. So, yeah, I've found a lot of women.
When do we take them out? Because people here might wonder that I'm anxious. I really want to get pregnant. My husband and my family, my in-laws are wondering, why are we not getting pregnant? And could be sometimes that. Can you also talk about how women need to realize that this is not a curse? Because a lot of times there's a lot of myths around it. A lot of times people, they are scared. I had a patient who was really scared because she was bleeding a lot. She was even scared to share it with her husband that she was bleeding due to uterine fibroids. Because there's this myth about automatically when you have it, you're done, you won't have kids. So maybe do you want to dwell much also on this side so that people don't get excitable and also scared that, oh, it means that I won't have kids. Like you've already mentioned that, you know, it doesn't mean that you guys won't have kids. Do you want to comment on when do we remove them, the size?
Okay. All right. So we remove fibroids when it is big enough to start causing symptoms. Most times it is or when it is on the baby bed where the baby is supposed to be lying, just like I showed in the diagram. Yes. Yeah. But anything, and then you also remove it sometimes when your doctor feels like it's what's affecting success of IVF. So sometimes you have like fibroid on the baby bed, and then it might be really small, like a sibling. and then we don't really want to take it out, and then you can still get pregnant with it. But sometimes when it's big enough and we feel like this is going to affect, going to compete with space, with the fetus, compete for space rather with the fetus, and then we ask you questions like, how many pads do you use in a day? And you're saying you use 6, 7 pads, and then the blood comes out with clot. We are worried about that. Yes, it means it's symptomatic, and then we want to take it out.
Awesome.
So, yes, yeah, and then you should not feel like you shouldn't feel ashamed of it, because I mean it's not your fault. We still don't know the cause of uterine fibroids, and like you might be in a public space, and the next 5 women that are close to you, 4 of them have fibroids. So I mean, it is that.
Like you said.
Yeah.
Yes.
And they don't even know. So, and a lot of women have gotten pregnant even with fibroid. Fibroid is not an absolute cause of infertility. It is not. So you can still get pregnant and then, live a normal life, basically.
Right.
Yeah.
I just want to comment on the fact that now when they affect fertility, because I remember, I'll share a story here. I had a patient who was 39 years old, and she had this pelvic pain for over 5 years. And unfortunately, she was seeing her GP. And unfortunately, at the time, there was no ultrasound that was ever done in those 5 years. And by the time I examined her, she had or a womb size that was like 5 months pregnancy, that the fibroids, so they have a potential of growing that much. And unfortunately, this woman, I had to refer her to a gynae clinic to remove the whole womb. So now, like you said, they compete in that space. So the fibroids, that lady, they were all inside the womb. There was no opportunity for her to fall pregnant. So do you want to comment on that, Dr. Marashi? When do people need to say, hey, I need to go? Because sometimes women, they stay worried and scared to even consult you guys.
Okay. All right. So sometimes, like I've had a patient that had fibroid up to just below her umbilicus, that's her belly button. Yes. And all she had to do was take out the fibroid, and we did her procedure some months after, and she still got pregnant. So it also still depends on where the fibroid is. So yeah, sometimes, and then it's also an indication for surgery, for surgical removal, because I mean, you can't be carrying your tummy, and then you can't be walking, and then your abdomen is all out. So some women might not have a problem with it, other women might. So that's it. And sometimes they might actually have fibroid that is that big, that has descended all the way below their umbilicus, but they don't have any symptoms. So those women now, they have an aesthetic reason to take it out.
Okay.
Aesthetic meaning just like the physical, the beauty, the physical aspect of it. So it's enough reason to take it out, because I mean now it is out there and they don't want it there. So yeah, you can actually take it out. Yeah.
Awesome.
So
yeah,
it depends on. Yeah.
Awesome. So, go ahead.
Okay, so that's like the major thing I wanted to talk about, fibroid, and then I wanted to also talk about the like mental health effects of fibroids and infertility, and so these are like really sensitive situations. And I have like patients come into my office, and most times they feel like it's like a safe space for them to talk about everything that that has actually been happening to them. And then the first thing they say is they believe that if they get pregnant, will finally be happy because they feel like infertility has made them sad and depressed over the years. And then when you probe further, you find out that it's environmental factors, has direct environment, mother-in-law, sister-in-law, friends, pastors, and then making you feel like less than you really are. And, I feel like people should be sensitive about these issues because you don't know what people are going through in their personal lives and you don't need to add to it.
Yes.
So, for the women that feel like the child, if the IVF is successful, the child will bring happiness to them. I think that you first have to find happiness within yourself, and you shouldn't let people make you feel like infertility is your fault. I mean, infertility is caused. 1/3 of the causes of infertility is from women. Another 1/3 is from men, and then the rest is actually from both men and women, or it cannot be explained. So don't carry all of the burden. I mean, this is male factors. There are also male factors. So you shouldn't carry all of the burden. You shouldn't feel like, besides, you are not the cause. Like, I mean, even if, like, for example, even if, okay, it's the fibroid that comes to infertility, you didn't put the fibroid there.
No.
Exactly. So it's not right for you to blame yourself and carry all of the burden. I feel like there is always a way out of every situation, and I feel like people out there watching should also be able to be sensitive about these issues and not go asking people, when are you going to get pregnant? How long have you been married? It's really not right. You don't know what people are going through. So.
I love it. You know what? It's interesting. We are both on LinkedIn. One of the influencers, guy actually, and he was carrying a baby, and everyone else was congratulating him. And he wrote a long post at the end. He said, "This baby is not mine. I've felt like I was not a man enough. I was depressed. I was angry, bored at myself that how could I not be able to have a child? How could I not be able to impregnate my wife?" So this can be hard also in men. Men, they internalize these emotions. I've seen quite a few men who are struggling with infertility. But then here's the thing. In Africa, like you said, there tends to be that blame shifted to women. So I like to emphasize here, men who are watching us, thank you so much for coming along. Let's be open-minded about these things. This could happen to you. There's 50% chance that the woman is not conceiving because the problem is with you. Like she's just mentioned, or the 50% is due to the woman, or the other person, you don't know. I like it when you mentioned the church. What is your experience with your patients and the pastors and also just the faith system they belong to?
Okay, so sometimes, you have patients presenting late to the clinic, and then when you ask them what happened, in the previous years, why haven't they come? And then they talk about having faith and how their pastors have said that they should not go and do IVF, that they should wait for God. Doing IVF is like you are not trusting God to do it himself.
Wow.
And then I try to educate patients and say that maybe God is using us here as vessels to help you. It doesn't have, it doesn't have to be like a miracle baby that just comes from us. There should be, you should do your part. God will do his part. And, some of them feel like they have sown seeds and they feel like maybe they've done something in the past that God is not happy about. And I try to explain to them that, I mean, these are life issues, and you just have to. I'm also a believer, a Christian, but then I also believe that let's do our part. And
Yes.
I've heard stories where pastors say the babies are not real babies, but then it's not only pastors that say this, and a lot of people say it. I mean, pastors are human beings, so I can't.
Oh my God.
Everybody says it basically. Not everybody, a lot of people rather. So I try to explain that they are real babies. I mean, you're going to have to carry the baby, and then you're going to give birth to the baby. The baby is going to go to school or wherever you want the baby to go to. And yeah, it's just different beliefs, different people. But most times, once they end up, once I meet them in my consulting room, it means they've gone through several stages of faith and so many things. And most times they wish they had come earlier. Most times.
Yeah.
Yeah.
I love that, Dr. Rashi. So people watch us. When you find yourself in this situation, yes, we believe. I love as African people, we are believers, but medical issues need to be addressed. And we have the faith. We love the faith. It's okay to pray, but let doctors take over and help you in due time. I love it, Doc.
Yeah. So, well, for now, that's like everything about fibroids that I would like to talk about.
Awesome.
And I mean, fibroids is actually not the only cause of infertility. There are lots and lots of different causes of infertility. But today I'm just focusing on fibroids because I'm trying to stay within this topic.
Awesome.
Yeah. So yeah.
Actually, you know what? Because we have enough time, do you want to touch on the sexual transmitted infections? How do they contribute to infertility? Because looking at our literature, we tend to have quite a bit of stats there around that as the cause.
Okay. All right. So, well, yeah, sexually transmitted infections cause infertility by causing adhesions. Adhesions are like when two different surfaces like rub on each other, like there's a friction, and then it like together, and then for example, let me give an example using my diagram again. Okay. So when you have sexually transmitted infection, it can ascend all the way to the tubes.
Yes.
It can ascend all the way to the tubes, and then you can see that the tubes are they're like tubes basically, so they can press on each other, cause a friction there, and the sperm that is supposed to go from here and go all the way will not be able to pass. It will not be able to pass to get to the egg. Let me see my camera. To get to the egg, so that can prevent fertility, because how pregnancy works is the ovaries release eggs here, the sperm swims all the way here, fertilizes the egg, and then fertilized egg travels all the way down and implants somewhere here. So if infection has closed up this tube, has caused adhesion and closed up this tube, or even closed up this place, the sperm wouldn't be able to go all the way to meet the egg. I don't know if that makes sense.
Yes,
but yeah.
Yes.
So
yes.
But then again, it is improperly treated sexually transmitted infection that can cause infertility.
Yes.
So that is why when a woman of childbearing age, especially a woman that has not completed her family, according to her, I mean, you can complete a family with one child, two children, and but especially when you've not completed your family or you've not even started having a family, when you have a sexually transmitted infection, treatment is very aggressive. We want to really treat and to ensure that everything is fine. So, but in a case where sexually transmitted infection is not treated or is not properly treated, it can lead to adhesion and then infertility. So, and then when you have recurrent sexually transmitted infection. So,
I love to touch on that topic because we see it a lot in Africa. And also I want to add to the fact that a lot of times men, when they get these STIs, the sexually transmitted infections, because their urethra is so short, they will get the symptoms and then they disappear. A lot of times men, they tend to ignore these symptoms and be like, oh, okay, I don't have symptoms anymore. So please, viewers, if you have discharge or you know yourself that you probably lead a promiscuous life, you have multiple partners, you are against that, and the use of condoms is fundamental, please go get treated. Because a lot of times men, they go around they go around with sexually transmitted infections that have no symptoms, and unfortunately could also affect your own fertility. I love that, doc. Thank you
yeah,
so much. Right, so
yeah,
tell
you're
me,
welcome.
what is the solution now? Here's a woman wanting to fall pregnant and you declare her infertile due to the STI. What is the next step for them?
Okay, so
Now
even with these two,
there's blockage now. Let's talk about the practical case.
the blockage,
What is
yeah.
the step for that
So
woman?
the solution to that is for her to do a procedure called adipolysis. So the procedure usually is minimally invasive. You can do it laparoscopically. That's just put cameras inside and then try to light just to break down the adhesions and make the place patent, make the tube patent so that the sperm can pass.
Awesome.
Yeah.
Yes, I just
So
want
there's
to viewers know there's hope, but of course, living
yes, yeah,
our lives healthily and consciously, mindfully is very fundamental. And also parents here to teach their children to avoid sexual activities when they are young, because unfortunately these infections Dr. Amarashi is talking about, these are infections that happen maybe when we were 14, you were sexually active, experimenting, and by the time you are ready to start your own family, when you are 28, you are married, you are 30, you are excited about starting a family, you get married, you have your education all set, boom, you are unable to give your husband a baby, or your family, or yourself, by the way. Now, it could be something that happened when you were young, you were 18, 14, naive, not protected. The importance of avoiding sexual activities is fundamental. Thank you so much, Doc. I really like it.
yeah.
Wow, time is flying. Do you want to add anything before I take questions from our viewers, please?
No, not really. I think I'm ready for.
You,
Yeah.
thank you so much. I'm really enjoying you here. Okay, so
Yeah.
I'm going to pull up our viewers. Hossam Conte, watching from Freetown, Sierra Leone. Thank you so much, Hossam. Thank you so much for watching. And we are hearing from him too. You guys are doing a great job. Thank you. Thank you. Thank you, sir. Um, and James, instantly gained a better understanding than I thought previously. Aha moment right there. Thank you so much, James. We like having men also on shows like this. Thank you, sir. Please share the word. And we have Mikey Rough Jam. He's watching from Southeast Asia. That's amazing. Wow.
Yeah.
We're reaching the world. This is amazing. Ricardo, Ricardo says, God has showed up, Exodus 2020. I'm not sure he's writing in the language I don't understand. Okay, so we have viewers here. If you have any questions for Dr. Amarashi, drop your questions right here. Like at the beginning, we don't have any stupid questions. And if not, we can actually close our show here. It looks like it's going to close pretty fast here. But the word I have for us here, let's be a woke community. Let's be a woke people by doing what we need to do. Let's not pass judgment to any couple that is struggling with infertility or you see in your community, in your family, not having those children. Like Dr. Marashi said in the beginning, you don't know what you have. So let's be conscious, let's be mindful, let's be sensitive, let's be compassionate, because we've seen people struggling with depression and anxiety. And a lot of times we do see people sometimes even committing suicide because they did not feel enough. So we don't need to add pain to what they are going through. And we've seen also, Dr. Amarashi, do you want to comment on the loss of marriages? We've seen men leaving their wives and even the pressure from the in-laws on this, telling their son to leave her because she's not there. Can you comment on that, sis? Thank you.
Yeah, so yeah, I have lots of patients coming in, and then sometimes, they want to do their procedure immediately, and then by the time you evaluate, you see that they have to do some, procedures before the main treatment. So by the time you try to shift the treatment to another month, they get so worked up because they feel like they're working with time, and they're scared that their husband will take another wife, and they don't have like much time to wait. And but then again, you have other patients with really supportive husbands, with really supportive in-laws, with really supportive friends, and you can see that most times those ones that are actually calmer, tend to, well, not most times, sometimes get positive results than when you're really scared. And because you need to have like maintain a positive mindset, you need to be calm. All of these things also sort of influence the treatment process. So when husbands, my advice to you is to be supportive, because regardless of who is the cause of the infertility, you have to be supportive. Why? If it's your husband that has the fertility issue, you have to be supportive, because when a person has like a supportive environment, a supportive community, rather, they tend to do better health-wise, mental health-wise, and then even the result of the treatment process is also better. So,
love it. Yeah. I love it. And Doc, do you want to comment on, there is also a possibility of having infertility even after you've had a child, both sexes. Do you want to comment on that, Doc? Because a lot of people think it's not my fault. I had a child 10 years ago, then it's your problem. Do you want to clarify that? Because a lot of times there's that unclear information out there.
Yeah, that's true. That's very true. Like, there's something called secondary infertility, and that means that you have had a child before and then you cannot have a child again. So, just like every other thing, change is constant. Just like every other thing in life, change is constant. Like, this year will not be the same. It's not the same as last year, and will not be the same as next year. So after having a child, there's a possibility that you could have gotten an infection that caused lesions, and then you can't give birth again. Or or as a man, maybe you change jobs, and then you're now driving long distances, and then the heat from the car is causing your sperm. You used to have low sperm count, or you contracted some sexually transmitted infection, or even tuberculosis. I mean, sometimes it's even something that is not even connected, like tuberculosis that can cause infertility. I feel like this is a very important information to put out there. Very important. There's something called secondary infertility, and it can happen to both the man and the woman. So if you're trying to have another child or even a third child and you've not been able to, you should reevaluate. You need to go to the hospital for medical evaluation again.
Yes. Love it. Yes, because a lot of times there's a lot of finger pointing in this regard. Like you mentioned, very important topic about the man also struggling with fertility. And you mentioned the pressure and the temperature. With this new fashion of the tight pants, men who are watching here, watch out, because the tight pants can easily cause a lot of heat in your scrotum. Then that could actually contribute to a low sperm count. I love it. Doc, I don't see any other comments. Oh, sorry. There is actually another list of people commenting here. Luandle saying, watching from RSA, informative sessions as always. Thank you so much, Luandle. Hossam, HIV/AIDS, has there been any cure for it? We wish. Not yet. Let's live our lives consciously, Hossam. And Yinka, what causes secondary infertility? Do you want to comment on that, Doc?
Yeah, I've mentioned a couple of things already. There are lots of like gynecological disorders that you can develop, like PCOS, which is a polycystic ovaries. The cause is unknown, but some women develop it along the line. Right. You can have sexually transmitted infection. You can have maybe extreme weight gain or weight loss. Can also can cause secondary infertility. Trauma to the reproductive organ can cause secondary infertility. Surgery, pelvic surgery. And I'm saying this for both sexes, both the man and the male and the female. Pelvic surgery can also cause secondary infertility. The list goes on and on and on.
So. Right. Yes. You know what? That was a good question, because like we go back to my comment, people go, I had kids before. Why would I not have now? So like you said, change is basically law of life. Things happen to people, and also I have patients that will tell me that their parents struggled having them as their kids, or you have a brother or a sister who struggles to have children. So there's also that component. And I mean, she's mentioning also changes in your body. And of course, in men, it could be you have low testosterone. So low testosterone is something that we see in men, because remember, your testosterone is your hormone that drives the sperm count. So you need to go check with your doctor. And before we close, I want us to normalize going to a doctor to just go for a physical examination. Let's normalize it, people.
Yeah.
The reason why I work in Canada, the reason why people in this side of the world live long, they screen, they come to a doctor and say, Doc, check me from top to bottom. Let's normalize that in Africa. We have good genes, but we are a reactive nation. When we are a reactive nation, things are caught late. Nothing much that can be done for you. So homework for each one of us here, normalize in the new year, go see your doctor and say, Doc, I need to check, what do I need to know when I'm 40? We're going to come back actually with another show where we're going to talk about what do you need to know when you reach a certain age in your body, or what tests you need to know. That's another show for another day, but make it your homework in the new year. Go see a doctor, normalize going for physical examinations. Don't be scared. Don't sit back because you are scared. You don't want to know. All right? So someone is asking, Doc, what causes uterine fibroids and why does it grow back after surgery? I love that question, Mrs. Niga. Doc, that's your question. Why?
Okay, so like I said earlier, when I was talking about uterine fibroids, there is no cause, like the cause is unknown rather. The cause for uterine fibroid is unknown, but research has actually pointed some factors to be a possible cause of uterine fibroids, and they include the female hormones, the estrogen and the progesterone, and also genetic implications. That is, maybe somebody in your family has it or had it, and then they believe there should be a genetic link to the cause of fibroid. Oh, and then why does it recur? Why does it regrow after surgery? It doesn't always regrow. It doesn't always recur. It does in some people, not everybody. So, and then before I'm sure on the consent form, when you want to sign for the surgery, they let you know that you are aware that it could recur. So there's no particular reason why it recurs. Maybe because you're still below, you've not gotten to the menopausal age. So you're still in that reproductive age where you're still producing the estrogen and the progesterone. So that is, you're already at risk for the fibroid. So yes, it can still recur. But once you have reached the age of menopause, those hormones are no longer being produced, and then it doesn't require anymore. Even the ones that currently they will shrink, and then
Yes, and being black, Yinka, also being a black woman, for some reason we carry a higher risk than other races.
Yeah.
This was beautiful. Thank you so much, sis. It seems like we are today, and I'm gonna thank Dr. Marashi here for such an informative discussion. I just want to tell our community here, bring your family. This is actually recorded, so you can actually rewatch this. Bring your in-laws, bring your colleagues, share this, share the button, follow our page. These issues matter to us, not only just to us. We are also married to the other races. So these things are important for us to understand who we are and also to understand other people better. And also, there's nothing that beats knowing things by knowing the facts. That's very beautiful, because a lot of times some people, they can function from a place of ignorance and start sharing stuff that is not proven or that is not science-based. So I would like you to share the button, share this, invite more friends. So every Saturday, we bring all topics that matter to us, that affect our mental health. Pledge with yourself in the next year, look after your mental health. Like I said, I took a break here for 5 weeks because I needed to take care of me. I needed some self-care procedures. So I was doing nothing. So that was wonderful. So look after yourselves. Enjoy this week that's coming. And we want to see you again next week. Same time, same place. Dr. Marathi, I'm hoping to bring you back.
Oh, yeah. I don't mind being here again. It was nice being here, and I'm glad I could make it here.
Thank you so much. Yes. And actually, I would like us to talk about in depth actually on IVFs, like all the types of helping people to fall pregnant. So that's another topic for another day. People, we're gonna bring Dr. Marashi back to talk about this. Thank you so much, Doc.
Yeah, thank you too. Thank you so much.
Thank you so much to our viewers. We'll see you next week. Same time.